Well, proper skincare practices are not just as you start to age. It's a routine and habit that you should actually start young. In a national survey, it shows that Atlantic Canadians are the least concerned with anti-aging issues. However, as teenagers get ready to head back to school, it's handy to have some well-guided tips from a professional on how to treat your skin at every age and even how to deal with that first breakout. So joining me this morning with more on this is dermatologist Dr. Julia Carroll. Good morning.
Morning.
Thanks so much for being here.
No, I'm so happy to be here.
I think this is something that's quite important to chat about, is having a good skincare routine, but I was actually really surprised by the statistics that were released that Atlantic Canadians really aren't that concerned about it.
Yeah, so 61% of Atlantic Canadians are not concerned at all versus a much lower number, in a place like Ontario. And we found also in the survey that 16% of Atlantic Canadians don't use a night cream. 8% don't use a serum, and about 11% don't use any anti-aging products at all.
Was there any reasoning behind it, maybe why there was such a disinterest here, or elements, I guess?
They didn't get into that part of it. I mean, it could just be habits that people have. It could be, different sets of values, potentially. I'm not really sure.
Right, and usually generations, too. I know that with mine, my mom started me young because she always had a really good skincare routine as well.
Yeah, I think exactly what your parents do, particularly for women, what your mother has done is often what you follow.
So I know that you brought in a number of really great products here today. What would kind of be your first tip on where people should start if they're looking to start some kind of a skincare routine?
So I wanted to break it down, and the way I think about things is, we're talking about back to school, and for me, back to school has always been my time to make resolutions rather than the new year. By January, I think, that ship has sailed. So I
totally agree.
So what I was wanting to look at was cleansing, treating, and moisturizing, and sort of breaking it down for all age groups. So starting with cleansing, for me, I think cleansing is very important because especially at in the evening, because you want to wash off the day. So you might have had pollution that you interacted with, bacteria, the makeup that you were wearing that day. So I always tell my patients it's non-negotiable. You have to wash your face at the end of the day. And there's lots of great options for doing that. For teenagers, I like a tool like this, which is a Clarisonic. And so it's a device that you can use, and it just is kind of a tool that I find teenagers kind of gravitate towards.
Right.
Women also.
And it's easy.
It's easy, right? It makes it kind of fun. And then other thing is to know that you can use moisturizers to treat problems as well. So we have a hydrating cleanser and we have a foaming cleanser. And foaming cleansers are great if you have oily skin, so that goes more towards our teenage population. And the hydrating cleanser might be a better option for a more mature woman who wants a little bit more moisture. So that's a brand CeraVe, and they have both of those options available.
I guess somebody who's young, how do they determine what type of skin that they have? Because I imagine that maybe if they're just buying a product and it might not actually work for them because it turns out they have oily skin and not dry skin.
Yeah. I mean, honestly, you can just do a little bit of a feel, and you can feel your skin. So if you have a T-zone, then you may, like that's oily, then you're going to go more towards that foaming cleanser. But the nice part about these products is they're gentle. So even if you have drier skin and you use the foaming cleanser, you're probably still going to be relatively safe there.
Okay, great. So then would you like to move to this one?
Yeah, so the next one is treat. So this is where, you can sort of hone in on what type of skin you have. So for example, the moms in the audience, they're important too. And so they might like to use something like a retinol. And so this is a new product that came out by CeraVe, and it's called the Skin Renewing Cream Serum, and it has retinol in it, and retinol is really helpful for exfoliating, but it also helps to increase collagen production. So it's targeted for the anti-aging crowd, but it actually would help some acne as well for maintenance.
That's what I was going to say too. Isn't it good for texturizing, kind of like resurfacing a little bit?
Yes. Yeah. And then the other thing is, say you are someone that's more prone towards acne. This is where you would get a serum. Maybe there's a product called Acne Free that's very helpful. It has salicylic acid and benzoyl peroxide in it, and those are great for the first signs of breakouts.
Is there anything too that you would recommend, maybe somebody who's going through a first breakout, how they can treat it, I guess, without overly drying your skin? Because I know lots of people react differently to those products.
Yeah. So one of the things is just a little bit goes a long way. So when you're using the product, you don't necessarily want to just put a whole bunch on one area, because once you have a zit, it's actually 6 weeks that it's been there.
Really?
Yeah. So most of the acne products we're trying to prevent new ones from coming. So yeah, if you have a date or big Friday night out, you want to get rid of that one zit, but we really want to think more preventatively. So using a product a little bit goes a long way, and using it consistently.
Great. That's a really good piece of advice. So we have one left, and we have about a minute as well, so
Okay.
let's go through this one.
So this is moisturize. I think it's really important to know that for when you're moisturizing, if you're acne prone, you should moisturize. And I always tell people, whatever we're doing, I want them to do it their face, their neck, their chest, and their hands as well. And one great product is a combination product, which is CeraVe Moisturizing AM, and it has sunscreen in it as well. So it has SPF 30 built in, so 2-in-1, making life very easy.
I was going to say, too, I know that a number of people with oilier skin kind of steer clear of moisturizer, but they should be using it as well.
They should be using it because if you've got products like the CeraVe products that have ceramides in them, it's actually helping your skin barrier be a better barrier, and you'll actually be more resistant to acne and breakouts.
Okay, well, thank you so much. Lots of great tips here for everybody that's kind of looking for a new skincare regime. You can also head over to Dr. Julia Carroll's website where all the information you need is. Facebook, Twitter, everything's up online.